We acknowledge that this presentation is being presented on the country of the Darug people of the Darug Nation and acknowledge their ancestors who have been traditional owners of their country for thousands of years. We also wish to acknowledge and pay our respect to the Darug people's elders past and present. In our presentation, Hannah will be presenting links between culture and health. Celestyna will be talking about the urban context. Vanessa will be presenting health promotion. Alice will be speaking about low birth weight infants. Vanessa will be talking about social determinants of health. And Hannah will finish up explaining the application to culturally competent and safe midwifery practice. Our aims and objectives were to firstly discuss the links between culture and Aboriginal and Torres Strait Islander health. Secondly, identify and explain the relevant Aboriginal and Torres Strait Islander social determinants of health that impact low birth weight infants. And finally, critically analyse considerations for culturally competent and safe midwifery practice in relation to health promotion in the urban setting for Aboriginal and Torres Strait Islander women in relation to the specific concern of the low birth weight infant.
Links between Aboriginal culture and health. Culture plays an important role in the health of Aboriginal and Torres Strait Islander people. Connection to culture promotes self and collective empowerment, resilience, and self-esteem, thus impacting the social and emotional well-being of an individual. The cultural identity of an Aboriginal or Torres Strait Islander person may include factors such as connection to country, language, kinship, traditions, and spirituality, which foster relationships between family and community. Connection to country is an essential element of the Aboriginal and Torres Strait Islander culture that links to health outcomes. Non-Indigenous Australians' perceptions of nature and land contrast the spiritual connection to place that is so vital to Aboriginal and Torres Strait Islander culture. In this culture, the community and the land are seen as one, thus leading to suffering for the community when a disconnection from land occurs. A disconnection to country leads to stress and a lack of control, which have been linked to poor health outcomes. Furthermore, the rich culture of traditions and language in each Aboriginal and Torres Strait Islander community can impact well-being. Research shows that participation in cultural activities and traditions, as well as the ability to speak the native language, have been linked with fewer mental health disorders. These cultural activities allow for communication that decrease the internalisation of anxiety and depression. The impact of continuity of cultural practices is evident in the study exploring the positive health outcomes of the Aboriginal community in Utopia, Northern Territory. Despite the low socio-economic status and low rates of employment and education, mortality rates were 40 to 50% lower than other Aboriginal communities in the Northern Territory. Cultural practices, including traditional hunting and gathering and spiritual connections, were maintained due to factors such as late colonial invasion in the area and the absence of government settlement. This study highlights how cultural practices link to improved health outcomes. In addition, the decision to seek mainstream healthcare and follow treatment can be influenced by culture. In the Aboriginal and Torres Strait Islander culture, health is maintained through traditional medicines and healers. Thus, the perspective of healing in the community may create a resistance to access mainstream health services. Research examines the perceptions of healing in an Aboriginal and Torres Strait Islander community. It is evident that in this community, bush medicines were preferred over accessing a mainstream health service. This perception is passed down from generations and seen as a way to maintain health. This cultural belief creates a perception that Western medications are dangerous and creates a mistrust of mainstream health services.
Before one can practice culturally competent care, it is imperative that one must consider the context of the community that they are focusing on and working within. According to the most updated reports, the total fertility rate for Indigenous mothers in urban regions was 2.4 births per woman, higher than that of non-Indigenous women. Foreseeably, women who live in major cities have the greatest level of access to health services than in any other region. However, only 50% of the services are public. This is an issue as Indigenous women are more likely to access public systems due to cultural safety and their lower socioeconomic status in this region. Despite these higher levels of access, there is only a 2% gap in the rates of low birth weight infants between the urban and remote regions. These rates pose debate that although there's more services in the urban areas, the lack of culturally competent care and Indigenous healthcare workers in the urban systems has diminished their success, as their neonatal health outcomes are similar to that of more disadvantaged regions. To overcome these inconsistent disparities, the Australian government launched the Close the Gap campaign, whereby its main principles influence the development of new services such as the profound Malabar Community Midwifery Link service.
According to the National Aboriginal Community Controlled Health Organisation, health promotion is a process by which Aboriginal people are empowered to improve and increase control over their health. It encompasses the physical well-being of individuals as well as considering the social, emotional and cultural well-being of the entire community. Health promotion enables individuals and communities to achieve their full potential and thus results in a state of well-being for the whole community. Health promotion is significant for both individuals and communities as it facilitates self-determination by targeting both the protective and risk factors of poor health to make it easier for individuals to make healthy choices based on knowledge gained from health education. It should be a core function of any comprehensive primary healthcare model. Unfortunately, many of the mainstream health services and health promotion resources are culturally inappropriate and unsuccessful for Aboriginal and Torres Strait Islander people. The main factor behind this is that health promotion imposes Western worldviews without consulting, engaging with or involving local Aboriginal communities. It is imperative that no organisation or individual should ever go to an Aboriginal community with health promotion resources already prepared. Throughout this presentation, we will explore how to work with Aboriginal communities to develop culturally appropriate health promotion for Aboriginal and Torres Strait Islander women with regard to low birth weight infants.
A baby born weighing less than 2,500 grams is considered to be low birth weight. The statistics are alarming. Aboriginal and Torres Strait Islander babies are almost twice as likely to be born at a low birth weight than non-Aboriginal and Torres Strait Islander babies. In the urban setting, for 2015, 6.3% non-Aboriginal and Torres Strait Islander babies compared to 11.1% Aboriginal and Torres Strait Islander babies. Why is a baby born at a low birth weight a health issue? A baby born at a low birth weight is particularly vulnerable during the early neonatal period. Evidence continues to grow that demonstrates that being born at a low birth weight is one of the greatest threats to health for an Aboriginal or Torres Strait Islander child.
Where people are born, grow, live, work and age make a momentous influence on an individual's lifelong health and well-being. These components are called the social determinants of health. Smoking is a cause of a baby being born at a low birth weight, and in 2016, 41.3% of Aboriginal and Torres Strait Islander mothers in New South Wales disclosed smoking at some point during their pregnancy. This compares to just 6.9% of non-Aboriginal or Torres Strait Islander mothers. The bottom line is not as simple as laying blame to factors such as smoking as a cause for low birth weight. Instead, the causes of the causes need to be explored. Health services are an important social determinant of health that impact the incidence of low birth weight infants. The Malabar Community Midwifery Link service is an outstanding example of a primary healthcare model that is providing culturally competent maternity care. The 2015 Australian Mothers and Babies report showed only a slight decrease in the proportion of low birth weight babies born across Australia to Aboriginal and Torres Strait Islander mothers between 2005 and 2015, 13.2% to 11.9%. Meanwhile, a study of the Malabar Community Midwifery Link service showed their care to reduce the proportion of low birth weight babies. Out of the Indigenous individuals who live in urban areas, 17% experience issues related to overcrowding housing, as it is an accepted state of communal living amongst the Aboriginal culture. Physical environments influence birth outcomes as overcrowded housing exposes the pregnant woman to increased risk of transferable infectious diseases and passive smoking. Due to increased social issues, 1 in 5 women even leave home, heightening their levels of stress and its biological effect on their baby's growth. Employment and working conditions is another prevalent social determinant of health, as unemployment is one of the 5 risk factors associated with lower birth weight infants. The correlation is made as unemployment is linked to low income, which restricts the mother's ability to sustain a healthy diet and afford extra medical services. The social environment is a social determinant of health that plays a role in birth weight. An Aboriginal community provides strong ties and support for members of the community. However, these communities continue to experience suffering due to social exclusion, colonisation, and the stolen generation. The support surrounding an Aboriginal woman may influence her decision to access care. Social exclusion in the form of racism and discrimination experienced in hospitals is a common influence in the decision not to access antenatal services. A lack of antenatal education can result in an unawareness of the need for behavioural changes, such as quitting smoking and eating a balanced diet to reduce the chance of having a low birth weight baby. Research has also found that 15% of Aboriginal women in Queensland travelled away from their communities to birth without a support person. This isolation results in increased stress to the woman and her community, which has a biological effect on the baby's growth. A study highlighted that increased levels of cortisol, even before conception, is associated with decreased blood flow to the baby, affecting growth and birth outcomes. Lastly, education is a prominent social determinant of low birth weight, as proven by a study conducted on an urban community in Sydney, who concluded that incomplete education was directly associated with lower birth weight infants. It is widely acknowledged that poor levels of education and health literacy are directly correlated with poor health status and lower incomes, as individuals lack the ability to manage their health. In regards to the previous discussion on smoking effects, the incidence of smoking is significantly reduced if an Aboriginal and Torres Strait Islander person has completed their Year 12 education, thus proving how influential this determinant is.
Although we are capable of finding and reanalyzing numerous studies to support the discussion on effective and culturally safe health promotion, no resource can compare to the first-hand knowledge and experience of leading academics and midwives who are currently working with Aboriginal and Torres Strait Islander women. So, we have provided you with an amazing radio interview that we heard online from ABC Radio Sydney with Shay Caplice. She's the clinical midwifery consultant from the Malabar Midwifery Link service. So here it is.
And this morning I'd like to introduce you to the famous Shay. Hi, Shay.
Hi, Wendy.
Thanks for joining us. Now, Shay, why is this unit, why was it formed in the first place 10 years ago?
Well, the Royal got behind the Aboriginal Maternal Infant Health Strategy that was out of New South Wales Health and went one step forward beyond that and asking the community what they wanted. Mm-hmm. So not only did they want to know the midwife and the Aboriginal health worker during the pregnancy, they wanted to know them during the labour and afterwards. So we formed a group practice, which took quite a while to develop, and what it does is continuity of care addresses all those issues around trauma and racism. So there's an acknowledgement of that and an acknowledgement of the history that the Aboriginal people have been through. And the group are very culturally appropriate and they're on call for women. Mm-hmm. So in having a small group taking care of people, you develop trust and engagement, and that is key in working with Aboriginal health.
We as a group wanted to gather further information and insights to help us interpret the scholarly research literature that we have referred to throughout our presentation. We wanted to know what is lacking in the mainstream maternity health system for Aboriginal and Torres Strait Islander women, and why academics and midwives and the literature we've read believes that Aboriginal and Torres Strait Islander women benefit from caseload midwifery care specific for Aboriginal and Torres Strait Islander women. We spoke to Professor of Midwifery Caroline Homer from UTS. She told us that Aboriginal women, need culturally safe maternity services. It's what they want for their families. They need services where women live, clinics near communities, and more Aboriginal health professionals working alongside women and their families.
Yep, and we couldn't agree more. And amazingly, the Malabar Service does that. Listen.
No, really, it's about flexibility. So the antenatal care will happen anywhere, wherever the woman feels comfortable.
Right.
Not all women feel comfortable coming into the hospital.
Sure.
We do community clinics, Redfern AMS, and we go to the homes, and we have a clinic at Malabar.
Caroline Homer reminds us of the robust randomised trial evidence that informs us about how all women benefit from continuity of care. But she made the point to tell us about why Aboriginal and Torres Strait Islander women need it so more. She looked at her research around the Malabar midwifery program and what women said. They said I wasn't a number. The midwife knew my story. She knew where I came from. And Caroline Homer just told us how much this can make all the difference to safe quality maternity care.
Thank you, Alice. As you mentioned, Caroline told us about the importance of Aboriginal health professionals, and it's great to hear in this next clip that the Malabar Service does just that, as their workers play the role of providing holistic care through a continuity of care framework.
The which?
A mentored midwife, so it's a position for...
you're bringing someone through, yes.
Yeah,
An Aboriginal midwife.
So it's actually an Aboriginal midwife, and she's a qualified midwife, but just bringing her into that caseload is a lot different to, say, going into a hospital system where you work, in maybe postnatal ward or delivery suite and things like that. So the casework that we do is really quite holistic care as well for the women. So we kind of mentor the Aboriginal midwife through that particular practice.
We also spoke to Renee, who's a recently qualified midwife, about her experience in working in a maternity mainstream system. She just again said caseload midwifery is the answer. We know that it improves outcomes, but even more how important it is for Aboriginal and Torres Strait Islander women. They shouldn't have to retell their stories, and they should be coming to places that they feel comfortable, or being met in clinics where it's safe, culturally safe maternity care for them. Let's help prevent trauma and listen to past trauma. Only will work with caseload midwifery care and Aboriginal health workers.
Culturally competent and safe midwifery practice. In 2010, Australia's National Maternity Services Plan set out a 5-year vision for 2010 to 2015 and highlighted 3 key focus areas for Aboriginal and Torres Strait Islander women. Firstly, increase the Aboriginal workforce. Second, culturally safe maternity care. And third, develop congruous models of care. However, it is time for a new National Maternity Service Plan that is continually monitored and altered to assure objectives are met. In 2016, the position statement calling for action, released by 3 professional organisations, highlights what is needed for Aboriginal and Torres Strait Islander women, as seen in the box on the slide. We believe that these areas can all be improved through the implementation of culturally competent and safe health promotion with regard to low birth weight infants in the urban setting. Culturally competent midwifery care should be an essential component of health promotion when engaging with Aboriginal and Torres Strait Islander women. As discussed throughout this presentation, the incidence of low birth weight infants in the urban setting can be reduced with culturally competent and safe health promotion. Health promotion is multifaceted and needs to include the following factors. The first essential factor is that the health promotion program is developed specifically for the local Aboriginal community you are working with. The community should be involved in establishment of the program by engaging them through consultation and ownership. Consequently, this results in health promotion that is delivered how, when, and where the community want it. As a midwife, we need to focus on cultural safety by working alongside Aboriginal health education officers to provide a link between the service and the community. The AHEO acts as a broker in order to understand and engage with each community to establish trust. The employment of Aboriginal and Torres Strait Islander health professionals and health workers is an important component of providing culturally safe and competent midwifery health promotion. In the urban context, we know that most Aboriginal and Torres Strait Islander women accessing health services are using mainstream services due to the lack of Aboriginal controlled community healthcare services. Therefore, it is so important that non-Aboriginal and Torres Strait Islander specific mainstream services employ Aboriginal and Torres Strait Islander people. Aboriginal and Torres Strait Islander workers act as cultural brokers between non-Indigenous and Aboriginal and Torres Strait Islander people. They can help to bridge the gap between Aboriginal women and mainstream health services. Aboriginal and Torres Strait Islander midwives make up 0.7% of the workforce. However, 4% of women giving birth in Australia in a year are Aboriginal and Torres Strait Islander. Employment of more Aboriginal and Torres Strait Islander midwives is needed to create a safe environment in order to provide competent maternity care for Aboriginal communities. When developing health promotion resources, research has shown that using plain language, pictures and animation is effective when providing health education on the risk factors for low birth weight infants. However, it is important to note that these resources should vary between communities based on the outcomes of consultation. As indicated in the Close the Gap report, health literacy amongst Aboriginal people is lower than non-Indigenous people. Therefore, to ensure our health promotion resources are utilised, it is necessary to provide audio-visual resources as an alternative for participants that may have lower literacy levels. Traditionally, Aboriginal communities incorporated the practice of Dreamtime storytelling to promote health. This style of education and midwifery practice promotes respect to culture as it considers the traditional use of Dreamtime storytelling. Another traditional Aboriginal cultural practice to consider is education through art. As a midwife, we would engage a local Aboriginal artist to create art specific for our health promotion program. This resource can help Aboriginal women understand the risks associated with low birth weight infants and behavioural changes to avoid this health outcome, along with promoting community engagement and belonging. Furthermore, sustainable and ongoing health promotion projects are another aspect of culturally competent maternity care. Research has indicated that ongoing projects are received favourably in Aboriginal communities when compared to one-off projects. By facilitating ongoing projects, the power is given back to the Aboriginal community by giving them the skills to understand and share with others in their community. These health promotion strategies are essential in engaging Aboriginal and Torres Strait Islander women with culturally safe services, such as the Malabar Community Midwifery Link service. Initially, the Malabar service was not received well by the local Aboriginal community, as the promotion of the service was not centred around what the community wanted. The perceptions of the community were that the service was not for them and seen as a Western service. Furthermore, the service initially contacted local Aboriginal women by phone calls to invite them to use the service. However, these calls made the women feel wary of the service. In time, the Malabar service has successfully engaged Aboriginal women and have seen positive outcomes. The Malabar service is an example of culturally competent maternity care that has reduced the rate of low birth weight infants in 1 year from 15% to 5%.
And so, it is evident that by incorporating the competent health promotion strategies that we have discussed, culturally safe maternity services such as the Malabar service can effectively engage the local Aboriginal and Torres Strait Islander community of the urban region. This engagement enhances health professionals' potential to reduce the unacceptably high rates of negative birth outcomes, such as low birth weight. By considering the unique link between culture and health and the relevant social determinants of health, it allows health services to target the disparities between Aboriginal and Torres Strait Islander women and non-Indigenous women.